So for a neuro assessment, you would start off by checking, obviously, their mental state. And to do this, you have to ask questions and see their responses and how they act. So you would check for a level of consciousness, whether they seem to be fully awake, kind of awake, all there, not there, orientation, which would be person, place, and time. What's happening? Do they know where they are? Do they know what year it is? Do they know who they are? Appearance would be another one. Behavior, facial expressions, if their appearance doesn't really match where they are or their age, there could be something a little bit off or something going on. If they're in a doctor's office in the middle of the summer and they're dressed for winter, there could be something that's off there. And their speech is a really big one, because if they're slurring their speech or they're rambling about something that has nothing to do with anything and they kind of just went off, then there could be something going on there. After mental status, you would start by checking the cranial nerves, and there's 12 cranial nerves, and it starts off with olfactory, which is smell. So the test smell you would do, you'd make the patient smell something, and to do that you'd have them close their eyes and you'd have them smell something and identify what they're smelling, or at least try to. Then optic is number 2, and that's vision. So this is simple. You just have them read something that's not too close but not too far, just a good enough distance where to see it they can see it. 3 is ocular motor, which is opening and closing of the eyes. So this, you don't have to actually do anything for this. You can just have noted it throughout the entire exam that's happened so far, whether they're blinking or not. You can test their pupils with a light, and whether they dilate or pinpoint, and how fast it takes. Trochlear. Trochlear would be the downward and inward eye movement, and to do that you would have them look down, like follow your finger down and up and in. To make sure they're able to do that. And then trigeminal is sensation of the face. So that would be like, you would have them bite, clench down, you could have them puff out their cheeks, wrinkle their forehead, frown, abducens would be next, and that's lateral eye movement, so that would be following it back and forth. Facial would be next, and that's you would close your mouth and you would taste something, and you would have to identify what you're tasting. And then acoustic is next, and that's hearing and equilibrium. And you could do two things to test it out. For hearing, you could stand behind the patient, whisper something, and see if they hear it. Obviously you wouldn't whisper too quietly, but you don't say it too loudly. And then equilibrium, you could have them close their eyes and stand on one foot. They don't even have to close their eyes. Stand on one foot. See if they're able to stand there for like a few seconds without falling over. Glossopharyngeal is swallowing. So you would just have them drink something and swallow and see if they're capable of swallowing, or if they end up coughing, and because that could lead to aspiration, and which can leave it really bad. And then vagus is next, and vagus is talking, and this is done just throughout the test. While they're talking to you, you can just mark that off if they're being coherent with their speech, if they're not slurring their words, if they're not stuttering or anything, if they're smoothly talking to you. Spinal accessory has to do with the spinal and the muscles attached to the spinal, and you can do that by testing with turning the head against resistance and shrugging your shoulders. And then hypoglossal is next, and that's moving the tongue against resistance. So the only thing you would put into someone's mouth is a tongue depressor. You wouldn't put your fingers in it, so you put the tongue depressor in and have them push against the tongue depressor with their tongue. And that's how you would test for that hypoglossal one. After the cranial nerves, you move on to testing the functions of different parts of the brain, the neuro system. So cerebellar is one, and that's balance and walk, basically. So Romberg's test, you have the client stand with their feet together, arms to the side, eyes closed, and because their eyes closed, it could throw off their balance. So you want to say they're able to balance with their eyes closed and without moving. Heel to shin would be having the client stand on one leg and with their other leg, with their arms to their side, with their other leg running their heel up their shin and seeing if they're able to do that without tipping over or falling over. Finger to nose would be next, and that's when the client takes their finger, they touch their nose, and then the nurse has their finger, and the client kind of just touches their finger and follows their finger with their finger. Sensory perception would be next, and there's two tests for sensory perception. One is stereogenesis, which is putting a familiar object, an object that the patient would be able to identify, in the patient's hand when the patient's eyes are closed, and allowing them to identify what that is. It could be anything, but something that's common that anyone would be able to identify. So pencils, erasers, cotton swabs, thermometer, really anything that's easily identifiable. And then graphesthesia, I don't know if I'm pronouncing that right, is when you have the client close their eyes, and then with their hand again, you draw with your finger in their hand either a number or a letter. Numbers are usually easier to identify than letters. People tend to use numbers because this, even for anyone, could be difficult to percept, basically. And then after that, you do deep tendon flexions, reflections, and that would be bicep, tricep, brachioradialis, Achilles, patellar. Achilles is the ankle, patellar is the knee, biceps in front, triceps in back, brachioradialis is the elbow. Then you start off with the plantar test, and the plantar test is basically the client is lying down and you take their foot, their bare foot, and you stroke it with something thin from their heel to their top of their foot. And in a healthy adult or like a child above a certain age, you should see dorsal flexion. But if you see fanning of the toes, it could be a problem. That's called the Bembinski and that's only seen in newborn babies. They're supposed to fan out when you rub their heel like that. So you want to see a flexion of the toes. And then after plantar is Kearnings, and that is when you bend the hip and the knee, and then you flex. They're both flex, and then you straighten the knee out. And they shouldn't be able to feel any sort of pain. If they do feel pulling or a stinging or any pain in their back or neck, it would be indicative of meningitis or some sort of meningitis. And then the next test is also for meningitis. It's when they're laying on their back and they flex their neck. So they kind of like touch their chin to their chest, and if they feel any sharp pains in their neck or head, it could be indicative of meningitis as well. And that's it for the neuro assessment.